Hello, welcome back. Today, we can finally actually talk about something nursing related. We're going to talk about TNCC, or Trauma Nursing Core Course. I had the opportunity to take this course a couple weeks ago. First time I've ever had to take it. I took it in person up at a different hospital than my own, and just kind of wanted to give you a review and some of my thoughts on it. So the entire point of TNCC, from an amalgamation of both their literature and just kind of what I saw, basically what it's designed to do is it's designed to teach something called the trauma nursing process. Now, the trauma nursing process is a very bare bones, linear approach to trauma care. That's the best way I can describe it. Basically, it kind of formalizes a step-by-step plan and or algorithm that you can follow if you end up having to take care of a trauma patient. For what it's designed to do, which the way that I read it, this course is designed for people who work at really any hospital outside of a trauma center. If I'm going to be very honest, if you don't have that much experience with trauma, or if you're maybe like a level 2 or a level 3, and just depending on where you live, it's just kind of a crapshoot of whether or not you will end up with traumas, this isn't a bad way to kind of go about taking care of the people who come into your care while you're trying to make a decision of whether or not you can just keep them at your facility and probably discharge them, or if they're actually going to need to be transferred. Really, the one-line review of this class would be this. This is something that should be taught in nursing school, but for a variety of reasons and just the very academia and historical, traditional, and rigid nature that is nursing school, it's not. It should be taught there. It's not, and I seriously doubt that any program is going to take the time to actually implement this curriculum into the rest of their nursing course. So let's talk about the actual class. So the class takes place. So the class, I took it in person. You can take it online if you want to, but I didn't want to do that, because I've got a family and it's very hard to get anything done on the computer with a 7 and a 2-year-old running around. If any of you have kids, you understand that. So I had taken it in person. Basically, it's over 2 days. The first day, it's all lecture and scenario work. It's a lot of PowerPoints from the Emergency Nurses Association. They're not very well made. But the instructors that we had, thank goodness, they basically acknowledge, it's like, look, this is the stuff that we have to teach. For you to get this cert, we have to stay, in this box of the TNCC process that's been prescribed by the Emergency Nurses Association. So it's like, look, we know this isn't all that great. We get that. We're sorry. Just basically shut up and deal with it. So yeah, day one, all lecture, and then you'll break up into some small groups, and you'll do some scenario work where basically you just kind of tabletop talk through different scenarios, and basically you're just practicing using the trauma nursing process as is laid out in the class. Now, some interesting things about this trauma nursing process, and so a couple things that they will hammer on, is there's a couple of spots in it, especially having to deal with airway breathing, circulation, and I think disability. There are some mandatory go, no-go things. So there are certain things, phrases that you have to or information that you have to ask for, or you have to say, it's like, I would check this, I would check this, I would check this, and you have to get a certain amount of them, otherwise you fail. And this is something that our instructor said, it's like, listen, you've got to do this, you got to go through this process, and you got to make sure you get all of these, otherwise we can't pass you. So that's all of day one. We started at like 8 o'clock in the morning, and I think we ended close to like 5:30. I mean, it's a full day. So that was day one. Day two is a significantly shorter day. Basically, you show up, you have 1 or 2 more lecture periods, and then you have to take your test. Now, the test that you have to take is the practical one. So this is where you have to go in the room. You got a mannequin, a whole bunch of medical equipment, and a proctor. And then they will read out a scenario, and basically you have to prove that you can go through the algorithm as prescribed, make sure you hit all of your mandatory wickets, and take care of the patient. And if you do that, you pass. So I think my test took, it was like maybe 10 minutes or so. I was probably in there like 15 because I ended up chatting with my the lady who was proctoring my test. She was a nurse and a former medic as well, so we just kind of shot the shit about the differences of how things work. And again, she really kind of reiterated to me, it's like, look, we know some of this stuff is dumb. We know some of this stuff, if you work in a level 1 trauma center like I do, it doesn't really apply. But, and this is something I didn't know until I actually talked to one of my supervisors back at my own hospital, one of the requirements to maintain your trauma center certification and status, which is given out by the American College of Surgeons, I believe, you have to have a certain percentage of your employees, nurses specifically, who have TNCC. I didn't realize that. So that's one of the reasons why they make you go through this, even though, to be frank, unless, like I said earlier, if you work in a level 1 trauma center, this is going to be, it's a step backwards in terms of your assessments. Now, again, if you've never worked in a trauma center before, and if this is like your first nursing job working in one, it's not that bad. If you switched units, it's not that bad, and you've never had to do kind of initial trauma assessment. I learned mine from EMS, and between all the teachers that I had and just 10 years of experience, you kind of learn how to do your own process. And the trick for me was, it's like, okay, I know how I assess a trauma patient. I just got to figure out how to make all of these little things, these very specific things that they want to hear, I just have to fit those into my normal criterion. I just have to fit them into my normal assessment process. Once I figured that out, it's not bad. So, once you pass your practical tests, they let you go. So I was there for only like 2.5 hours the second day, which was great. I got to drive back home, got to go be with the family. But once you pass that, that is when you get your blessing that you have to take your written test. Now, this test is taken online through the ENA's website. And the interesting thing is you have 1 week from the time when your class ends to when you have to have taken the test. You get 2 chances to take it, and you have to score an 80% or better to pass it. Now, the test itself, it's trauma trivia, and it's open book, open note. There is a time limit on the test, and I think it's like 2 hours or so. So one thing that they really warned us about is like, do not wait until 2 hours before the deadline to start your test, because you may not get it all done. And if you hit the deadline, your test is automatically submitted and graded, no matter how much you've gotten done. I've heard of someone who took the class, passed all the practical stuff, came home and completely forgot about the written test, and then had to do the class all over again. So don't do that. You're all adults. Take your silly test. So that's my review on this. It's 2 days. It's a practical exam where you have to follow an algorithm. And other than that, it's trauma trivia from an open book, open note test. For me, it didn't do a whole lot. It honestly felt like a step backwards compared to where I think the experiences that I've had. But it's required for trauma center certification. So, like all of academia, I'll say it again, play the game, win the prize. Thanks for sticking around. See you on the next one. Bye.